Welcome back. Today we'll be covering the skull. So there are several components of the skull. As you know, there are these, lines in the skulls. Those are called sutures, and they are made out of dense fibrous tissue. The skull is also composed of the mandible, the cerebral cranium, which is called the neurocranium, the visceral cranium, which are the bones of the face. The vault or the calvaria is only the top half of the skull, and then there's going to be the base of the skull. So you should know there's this plane that goes right through the zygomatic temporal all the way back to the occipital protuberance, and that's what orients the skull in the anatomical position. So the bone of the skull is made out of two layers, the external and the internal lamina. And in between those two compact bone is a layer of spongy bone called the diplo. The neurocranium consists of the frontal, the parietal, occipital, temporal, sphenoid, and ethmoid bones. And the visceral cranium is made of the zygomatic, the maxilla, the nasal, the lacrimal, the vomer, which is within the nasal cavity, the palatine, the inferior concha, and the mandible. So, and the anterior of the skull is, predominantly the frontal bone, and then there are the superciliary arches, which is also known as the Neanderthal ridge. It's definitely more prominent in males. And on that is the supraorbital notch or the foramen. This is variable. Some people have a defined foramen and some people only have a notch. And these can even differ in the same, person. And then there are the nasal bones, which are the septum and the vomer. And it is also consists of the superior and the middle nasal concha. That's connected to the ethmoid bone and the inferior concha. And those conduct, the mucus and the nasociliary fibers that will go and ascend into the cribriform plate. And then there is the frontal sinuses and the maxillary sinuses. It's important to distinguish that the vomer comes from the maxilla, right? So it goes upwards, while the perpendicular plate descends, and it comes from the ethmoid bone. So the maxilla forms the upper jaw and the hard palate, and it binds in the intermaxillary suture. Right here is the infraorbital foramen, is where the trigeminal nerve exits, or one branch of it does. And the alveolar arches is where the teeth attach. And hemorrhoitis is the infection of the maxillary sinuses. So there are the zygomatic arch. It's important to know, depending on your anatomy book or for your professor, there are parts of the zygomatic bone. So this would be the frontal process of the zygomatic bone. And this would be the orbital surface of the zygomatic bone. And down here would be the temporal process of the zygomatic bone. Right here. And right here would be the actual zygomatic arch. So on the zygomatic bone in general, there's the zygomaticofacial and the zygomaticotemporal nerves that pierce it. And then the mandible is made out of the ramus, or the rami, that's the plural, the angle, which is right here, of the jaw, the body of the mandible, and the protuberance is the chin. The mental foramen are where the cranial nerves 5 exit. I didn't put it in the notes, but it's important to know that the frontal sinuses and the maxillary sinuses are used as voice resonators, and is also used to lighten the weight of the skull. So let's go in depth into the orbit. So the orbit is made out of the frontal bone as its roof. Laterally, we have the zygomatic and the greater wing of the sphenoid. The floor is made out of the maxilla. Medially, it is made out of the ethmoid, the maxilla, the lacrimal, and the sphenoidal, like kind of back there. On top is the supraorbital notch, and then there is the infraorbital groove and canal, and then there's the nasolacrimal canal. So inside the inferior orbital fissure, it conducts the maxillary nerve of cranial nerve number 5 and the zygomatic branch of that, along with the inferior ophthalmic vein and the sympathetic nerves. So the superior orbital fissure conducts cranial nerves 3, 4, 5, and 6. The anterior ethmoid foramen and the posterior ethmoidal foramen, they conduct the anterior and posterior ethmoid vessels and nerves respectively, and those communicate with the ethmoid labyrinth and the anterior cranial fossa and the nasal cavity. And then the optic foramen will conduct cranial nerve number 2 and the ophthalmic artery. Laterally, the pterion is an important clinical feature because it is the thinnest bone and it overlies the middle meningeal artery and vein. So any blow to the temporal fossa, especially in the pterion area, it is quite dangerous and would lead to very dangerous, like, hematomas or a bleed. So the superior and inferior nuchal lines or temporal lines are the attachments for the temporal muscle and fascia, which will cover the temporal fossa. So the infratemporal fossa is composed of the pterygomaxillary fissure, and that will conduct the posterior superior alveolar nerve, which is a branch of the trigeminal nerve, and the maxillary artery. And the Pterygopalatine fossa is a neurovascular crossroads. That's where these nerves, along with a bunch of venous plexuses that will drain the face, will converge, and those communicate with the orbit via the inferior orbital fissure. Alright, so even deeper is the Pterygopalatine fossa, and that communicates with the infratemporal fossa through the pterygomaxillary fissure, which is right here. Medially, it goes into the nasal cavity through the Sphenopalatine foramen, and superiorly, it goes into the skull through the foramen rotundum, and anteriorly, vessels will go to the orbit through the inferior orbital fissure. So the Pterygopalatine ganglion is a parasympathetic ganglion, and it lies fairly close to the Sphenopalatine foramen, and below that is where the maxillary nerve crosses, and it supplies the lacrimal glands, the paranasal sinuses, the mucosal glands, and the gingiva, and it communicates interiorly with the nasopalatine nerve. Look here, it just, all of these innervations right here. It goes into the eye too, and then here's the facial nerve. So even in a smaller, more precise area is the Sphenopalatine foramen, and that connects the nasal cavity with the Pterygopalatine fossa. So this will connect all those neurovascular crossroads with the nasal cavity, and that will transmit the Sphenopalatine artery and nerve. All right, that's it for now. Thank you for your attention, and good luck studying.